Dr. Eric Ibegbe. I'm a board-certified gastroenterologist. I'm also a bariatric physician and a cosmetic physician. I've been helping people over the last several years that have had problems with their weight. We've had these great innovative procedures like ORBERA balloon and Aspire Assist and even Obalon. These are some of the procedures that we've been performing for the last several years in Kingston and in Jacksonville. However, there's been a subset of patients that have not been able to help over the years. And these are patients who've had gastric bypass surgery or people who've had gastric sleeve. And for many years, I've had no option for those people. As a matter of fact, out of every single phone call we get for the ORBERA balloon, for example, we probably get about 2 or 3 phone calls from people who are interested in ORBERA, but they can't qualify for ORBERA balloon because of the fact that they've had bypass or they've had gastric sleeve. These are contraindications to the balloon. And so for years, I had no options for these people. However, recently, Apollo Endosurgery has been able to devise an endoscopic option that is non-surgical for patients that have had bypass who have regained the weight. We know about 50% of patients after 5 years of their surgery will regain weight. And the reason behind that is what I'm going to show you on my iPad very quickly. So when bypass surgery is performed, a smaller stomach we call a gastric pouch is created. This is connected to the jejunum, which is the small intestine. And so when a patient eats, food will literally go from the esophagus into the small pouch and directly to the small intestine, bypassing majority of the stomach, which is where the whole idea of bypass comes from. But what happens, unfortunately, is as years go on, typically 3, 4, 5 years, the connection between the pouch and the small intestine begins to widen. And as it gets wider, patients don't experience that full feeling that they once upon a time had after their surgery. So as they don't have that full feeling, they continue to eat because they don't really realize when they're full. And what happens? They begin to gain weight again. And so this is where this new procedure we call Bariatric Revision comes in place. It's an endoscopic procedure where we use endoscopic sutures to narrow the connection between the pouch and the small intestine again. And therefore we're able to recreate that small exit, if you will, so that patients have the opportunity to get full and feel full after they've eaten a meal. And therefore they will begin to lose weight again. So this is now available right here in our offices, both in Kingston and in Jacksonville. And endoscopic bariatric revision takes probably about 15 to 30 minutes to perform. So it's very quick. Patients can go home the same day. There's no real downtime and there's no need for hospitalization. So if you've had gastric bypass, or you know somebody who's had gastric bypass and now they're struggling because they've regained the weight again, finally, we have an option that I believe is going to make a difference. So call our office, check out on our website, email us, let us know if you would like to have an appointment to see me, and I'll be able to converse with you more on this topic. And I look forward to seeing you, helping you. And I'm so excited that finally I have an option for patients who've had gastric bypass or gastric sleeve. So if that's you, call us today.